So I'd like to introduce myself. I am Dr. Laura Frank, and I live in the Pacific Northwest. I am a nephrology medical science liaison with Otsuka. I'm also a registered dietitian, and I'm very passionate about the topic today. I'd like to invite one of our advisors for Nephew Nutrition. His name is Dr. Shivam Joshi, and it is my pleasure to have him on as a co-speaker for me today. He is an internist and a nephrologist, and he is, believe it or not, a plant-based physician. He actually just received the Joel D. Koppel Award at the NKF in recognizing how he's been a game changer in the field of plant-based nutrition, especially for people with CKD. Dr. Joshi, thank you for joining us today.
Thank you for having me today.
Yeah, it's been great to work with you on this slide deck. So you can follow Dr. Joshi on Twitter at sjoshiMD, and you can also visit him on his website at afternoonrounds.com. And a lot of this information that we're going to be discussing today, and especially his research in particular, you can find reference to those articles on that website. So I'm going to talk a little bit about what we're going to do today. So our objectives is to briefly level set on what is chronic kidney disease, to discuss the interrelationships between hypertension and CKD, and then we're going to talk about a lot of the benefits of a plant-based diet in the management of hypertension in CKD. And I'm going to hand the stage over to Dr. Joshi.
Okay, hi everyone. Thanks for joining us. Thank you, Dr. Frank, for having me. It was a pleasure working on this with you. So, just a little bit of basics. So, when we talk about kidney disease, there are 5 stages of kidney disease, and this helps both healthcare professionals and patients understand the severity of the kidney disease. So, the least severe is stage 1, and as you go down in kidney function, the stages increase up to stage 5, which is the last stage of kidney disease, and that's generally about less than 15% kidney function. What we use as physicians and healthcare professionals is a GFR, and that's defined as less than 15. We use the percentage as kind of a rule of thumb to help explain it to patients and other people who may not be familiar with this concept. But you can have stage 1 kidney function and have a GFR greater than 90. This can happen in people who have lost a part of their kidney or had some damage. And you have to have kidney dysfunction for at least 3 months to be classified as chronic kidney disease. So there's a time component to it as well. The topic of our talk today is about hypertension, and this relates to kidney disease because hypertension is both a cause and complication of kidney disease, and they both feed off of each other. And high blood pressure is the second most common cause of kidney disease. And though for those who have kidney disease, there are intrinsic complications of the reduced kidney function that lead to a higher blood pressure. So these two kind of go hand in hand. And for most patients with a moderate to severe kidney disease, hypertension is something that is relevant. So as kidney function declines, you have an increase in hormones like renin, angiotensin, and aldosterone. And these things ultimately lead to high blood pressure. So as I was mentioning earlier, the decline in kidney function causes hypertension through these intrinsic mechanisms, and what we're referring to is the activation of the RAS system. So once that RAS system is activated, you get impaired sodium excretion, meaning you're holding on to more sodium. You have sodium retention. You have water retention. And then these hormones also stimulate the sympathetic nervous system and can also lead to an increased vascular resistance. All of these things lead to high blood pressure. And then, of course, uncontrolled high blood pressure can lead to further kidney function decline. And then the cycle repeats itself. So, as mentioning earlier, hypertension and kidney disease has a close relationship with each other. Unfortunately, about 1 in 2 adults in America have high blood pressure, and that risk increases as we get older. So, by the time we're in our 70s and 80s, upwards of 90% of us will have high blood pressure, which is unfortunate. but not everyone with high blood pressure has kidney disease. However, because of the concepts that I mentioned earlier on the last slide, many people with kidney disease do have high blood pressure. And that's kind of shown in this shaded area. Between 85% and 98% of people have high blood pressure in stages 3 through 5 CKD. Fortunately, not as many people have CKD as they do high blood pressure, but nearly 1 in 7 adults does have CKD. Something that's of interest to me and many of my patients is how can nutrition and lifestyle affect the development and progression of high blood pressure and kidney disease? And there's a lot of things that we can do in terms of our lifestyle to prevent the development progression of both of these diseases. And that includes engaging in physical activity, having a normal body weight or losing weight if you are overweight, reducing alcohol consumption, reducing sodium intake, and also smoking cessation. So, a lot of these unhealthy vices that are common in society can lead to development of high blood pressure and kidney disease. And changing these in our day-to-day habits can affect our long-term health. A subject of deal of interest to me is plant-based diets and hypertension. Plant-based diets, either predominantly or completely, can be useful for the treatment of high blood pressure. In almost every algorithm and guideline, the first line treatment is lifestyle change. And within that, plant foods are a core component because they've been repeatedly shown to lower blood pressure in the patient populations that they've been studied. There's a lot of benefits to plant-based diets. Some of the big benefits as they relate to high blood pressure in CKD is that they tend to be high in potassium and low in sodium, which is beneficial for reducing blood pressure. They also have additional benefits in that they're low or almost absent in animal protein, low in saturated fat for heart health. They're also low in absorbable or bioavailable phosphorus. The high fiber content of these foods can lead to favorable effects on the gut microbiome. And then they also have antioxidants and nitrates that can also help with blood pressure and reduce inflammation. And then even the amino acid types, which we'll talk about later, can also play a role as plant foods tend to have favorable amino acid types. So, to touch a little bit more on sodium and potassium, if we look through human evolution, our Paleolithic ancestors consumed a high potassium diet that was very low in sodium. So the potassium content was anywhere between 11 and 15 grams with less than a gram of sodium. So the ratio was 16 to 1. We talk about this ratio to kind of put these numbers in perspective. The reason that this ratio is important is that it favors potassium more than sodium, and that has a positive effect on reducing blood pressure. And because of the scarcity of sodium during human evolution, the human body has developed mechanisms to hold on to sodium, but to excrete significant loads of potassium. Fast forward to today, the average Western diet has the opposite ratio, which is a sodium content that is very high and a potassium content that is very low. So you're going from a ratio of 16 to 1 to perhaps a ratio of 1 to 5. Today, on average, Americans consume about 3.4 grams of sodium per day, and this is more than is recommended. And we also consume less potassium than is recommended, which is 4.7 grams. So things are a little different in terms of sodium potassium for us today. The amount of sodium that we eat on average is certainly more than what is recommended. So the recommendation for sodium intake, the adequate intake level, is about 1.5 grams for adults in younger to middle age, and then it's lower, it goes down to 1.3 grams. For perspective, a single teaspoon of salt contains more than either of those recommendations. It contains about 2.3 grams, and this is equivalent to about 100 millimoles or 100 milliequivalents of sodium. The reason we decided to go with this talk is that a lot of things are changing in the area of high blood pressure and kidney disease and plant foods, and that our traditional recommendations have been to avoid eating fruits and vegetables due to their high potassium content. But as this slide shows, we're kind of putting those recommendations into the trash can and evolving towards embracing more plant-based foods, including for patients who have kidney disease. So we are now recommending that the diets for these patients include a higher proportion of plant foods of at least 50% or more because these foods have been associated with positive health outcomes.